Good morning to everybody. The topic that I'm going to address here today is clinical importance of registries. As you might know, some years ago, the Portuguese Society of Cardiology decided to create a program on registries that has been working across the years. In January 2012, we are going to commemorate the 10th anniversary. And this program has been quite successful. We gather a lot of information in the last years, and we do hope that new registries such as the ones that the working group of myocardial disease is going to develop in Portugal will also be a major asset to our society in order to try to understand better the problematics involved in myocardial diseases in Portugal. So, can I have the next slide? So this is basically the structure of my presentation. I will give a short introduction, then I will speak a little bit about the clinical importance of registries. I also will address the limitations of the registries, and I will finish with some conclusions. Next. So as far as the introduction is concerned, next. We do know that in our clinical practice we use some knowledge that is coming from not only from guidelines that are established at European or at international level, but also from medical experience that we gather along the years and also that we learn from older colleagues that taught us. There are also other resources that we can get and from where we can get a lot of and gather a lot of knowledge. Now the problem is that still across the years there are many clinical problems that we face on our daily basis, and in order to solve these clinical problems, next, we have the need to develop clinical trials to try to solve some of the questions that we have. We may need to also to develop clinical studies, but also a good source of data is also the national registries. And of course, if all this information is collected and together with experts' experience, we can then address new information and produce new guidelines. Next. Now, in terms of the registries, this is an important part of ways of collecting information. Next. And there are some key attributes of an effective clinical registry. One is a standardized data collection with definitions and reporting. There is also the need to integrate tools for rapid feedback to participating in instruction, and this is something that we did in the past in terms of the Portuguese registries. There is the need to also to have a proper ethical review of procedures. There is also the need to have electronic data capture, and ideally it would be nice to have 100% participation of centers. Next. Also, it would be nice to have a consecutive enrollment of patients in terms of getting a good representation of what happens inside the country. There is also the need to establish an auditing process, at least for some centers across the years. Also, to try to get a centralized data compilation and statistical analysis performed by professional statisticians, and this is something that we already have in Portugal in our National Collection of Data Center. Also important is to report or collected data on a regular basis in order to inform the society members about what is going on in our country. And of course, there is the need also to have a transparent reporting of investigators and funding resources in all publications. Next. Some years ago, the board of the Portuguese Society of Cardiology, that was chaired by Professor Seabra Gomes, decided to create the program of the registries that we now have in Portugal. Next. Next slide. Can I have the next slide, please? Não. Acho que eles vão fazer aqui. So this is some pictures from the center that we have in Coimbra with the permanent staff that is working there. Next. And this is some of the information that we have nowadays. As far as the acute coronary syndrome registry, we have more than 35,000 patients. In terms of the PCI registry, we have more than 41,000 patients involved. In terms of hypertension and hypercholesterolemia registry, we have nearly 300 patients. And as far as the metabolic syndrome registry, we have more than 16,000 patients involved. Next. So in total, we have more than 94,000 patients. As far as the clinical importance of registries, next. We do know that in this kind of studies, data are collected from the real-world population, which is significantly different from the population that is involved in clinical trials. Actually, some of these patients would be excluded from these randomized clinical trials in a variety of clinical settings. And also, registries are extremely important because they can assess whether or not randomized controlled trial findings are applied to this unselected clinical population. Also, we do know that randomized clinical trials are costly, and they also have limits the size of population under study. And on opposite, registries can survey large populations in a very, I would say, cheap way. Next. Now, also a very important aspect of registries is to identify practical patterns and new needs. An example, next, of what I'm talking about is present in this slide. It's the antiplatelet medication across the years from 2002 until the present moment. And as we see, there is a major change in terms of the pattern of treatment, in terms of dual antiplatelet agents across the years, while the 2B3A inhibitors are relatively constant across the years. Next. Another example, invasive strategy in non-ST elevation acute coronary syndromes, a major change in pattern in the recent years. People are becoming more invasive and early in the phase of the acute coronary syndrome. Next. Also, another important aspect of registries is the evaluation in the community of therapeutic benefits, risks, and costs. Next. And this is also a very nice example. If you take a look to the ST elevation myocardial infarction, when we started the program, the death rate was nearly 10%, and now it's slightly over 5%. So there was a major benefit on the population regarding the new therapies. Next. We can also identify rare side effects and device failures with registries. We can track long-term effects. We can track adoption of new therapies and off-label use. And we also can use measurements to stimulate the practical changes. Next. And this is also a nice example. This is the rate of use of statins across the different centers that are participating. And we see the major differences sometimes in the use of statins. And this is important because it will allow us to identify those centers that might need to have special measures in order to try to improve the application of statins in their patients. Next. We can also evaluate quality of care and quality improvement. Next. And I think that one good sign of quality is the compliance with guidelines. At the beginning, the compliance in guidelines in terms of treatment, in hospital medical treatment of acute coronary syndrome patients was not that good. Things improved substantially over the years, but we can still do a better job for the future, I'm sure. Next. We can also use prospective registries to produce a lot of data regarding many characteristics of patients, treatments, and outcomes in a substantial large number of patients. And we can analyze this data and use it not only to produce investigation, but also to try to answer to a substantial amount of questions that eventually can be answered only by randomized clinical trials. And also, registries can identify novel associations, generate the hypotheses for future randomized clinical trials to confirm or eventually disprove. Next. Next slide. Next slide, please. In terms of limitations of registries, next. One major limitation is that data is frequently collected for non-research purposes, such as clinical practice reasons or administrative of just billing. Clinical data frequently has missing data, and this is also a major limitation. There are actually problems with follow-up, and we do have this problem here in Portugal also. And also there are non-randomized comparisons, and this has a confounding impact on the analysis of data. Next. It should, however, be noted that prospective registry populations are not randomized, and this makes really a large problem, because as far as the analysis of treatment efficacy, we may run into problems. Next. And a good example of this situation was coming, for instance, from the SCAR registry, from the Swedish registry, because in the first analysis, it was shown that drug-eluting stents had an increased mortality, but in a second analysis that was performed later on, this finding was not proved again. So there are problems in terms of analyzing treatments. Next. As far as conclusions are concerned, next. We do know that there are strengths and weaknesses in both clinical trials and registries, and if you look to the clinical trials, the strengths are defining treatment effect and defining safety. In terms of weaknesses, it's the short duration, the lack of being able to generalize the conclusions, it's too expensive, lack of safety evaluation in high-risk populations. In terms of registries, it includes the full spectrum of the patients, and this is a strength. It defines how treatment are applied and also the population outcomes, and that's very important, but also has weaknesses such as unmeasured confounders, unreliable inference about treatment effects, and lower data quality. Next. So in the end, combination of high-quality clinical trials and prospective registries are really needed to define and apply effective therapies. In order to make best use of the available information, we need to be aware of the strengths and limitations of both registries and clinical trials. And trials and registries provide answers to different questions and are complementary. Next. So I would say that really registries and clinical trials are needed, and they fit each other very well in terms of collecting data for our clinical practice. Thank you very much for your attention.